Today I want to talk about two categories of trauma: how to recognize the symptoms of trauma and where to look for help. We're going to talk about big T trauma and little t trauma. Big T trauma are those major catastrophic events like physical abuse, sexual assault, the death of a family member, witnessing an act of violence, living in a war zone, being caught in a natural disaster. All the things we classically think of as trauma are probably big T traumas. Little t traumas are harder to identify. They're the ongoing, distressing situations like bullying, verbal abuse, neglect, living with an alcoholic parent, having a family member with severe mental illness. And I see little t trauma a lot these days with women whose marriages are threatened by pornography. Trauma always involves loss of a family member or friend, loss of a home, loss of our safety, loss of ourselves. And sometimes we cope with trauma by telling ourselves that it's normal. It's normal for bombs to drop in the middle of a war. It's normal for a mom to be asleep all the time since she's an alcoholic. It's just normal in our world. Later on, however, we might experience difficulties in all kinds of different areas, and that lets us know we've got some processing to do. We might experience physical signs of trauma like low energy and fatigue, sleep and eating disturbances, or maybe even physical pain that doesn't seem to be connected to anything. We can have emotional symptoms like feeling out of control, being irritable and angry, feeling numb, feeling anxious, feeling depressed and fearful or panicky. We can have cognitive disturbances like difficulty with decision making, memory lapses, difficulty with concentration, feeling distracted all the time. We may have behavioral signs and symptoms like being very compulsive, developing a substance abuse issue, having an eating disorder, any kind of impulsive, self-destructive behaviors. And some folks will re-experience the trauma with intrusive thoughts that they just can't make go away, maybe with nightmares, maybe with flashbacks. Now, not everyone experiences trauma in the same way, and most people with time and good self-care will recover from trauma, but about 30% of people will develop the full symptoms of post-traumatic stress disorder, or PTSD. Now, it's interesting to me to note that some of the risk factors for PTSD include a lack of social support and a lack of validation for what's happened to the victim. If you've had some previous trauma, you're probably more vulnerable to PTSD. And if you've experienced interpersonal trust violations in the past, that can leave you more susceptible to PTSD. And if you happen to think that feelings are a weakness, you're in trouble. Because it turns out that denying the incident and pretending that we don't need help actually puts us at more risk for problems. Identifying the problem as a real problem and finding support can be the first step toward healing. If you're interested in learning more about trauma and its current treatments, I highly recommend The Body Keeps the Score by Bessel van der Kolk, who has worked with combat veterans for many, many years. And if you happen to be experiencing any of the symptoms that we've talked about here, I'd recommend that you find a therapist in your area who can help you work through that trauma. There's a wonderful directory at psychologytoday.com, and what you'll be looking for on that directory is someone who says that they are a specialist in PTSD and trauma, and if they have the letters EMDR connected to their name, so much the better. Trauma is a tough topic, but I hope talking about it today has helped you like it helps me. Okay.